Welcome to the DoubleACS Daily News for June 5th, 2017. The Attleboro YMCA recently held an opioid abuse and addiction informational session. The event featured Dr. Bratberg discussing how to create a safer community in the midst of this epidemic.
Because the opioid epidemic is something that I research and study as a public health researcher and pharmacist, I know that it's affecting our community, our county and our state and our region and nation all in a really big way, and I wanted to share my expertise with the community here. I think a lot of people think, you know, why are we focusing on this when we aren't focusing on things like smoking or alcohol or cocaine or other drugs? And I think it's because we see that for the past 10 years or more, every year we see more and more deaths from opioids. We see more and more deaths from actually illicit opioids like heroin, and heroin that has fentanyl in it that's manufactured or abroad. We see a shift from prescription opioids to that. We don't see those shifts in those other drugs. While alcohol and cigarettes kill many, many hundreds of thousands of people, we see 33,000 people die in 2015, probably more like 50,000 in 2016, and almost at least 2,069 people, according to the last count, in Massachusetts died, making it one of the highest rates of opioid overdose. So it's very important. And so the misconceptions that come by, people say, well, they may understand that people who use alcohol, it's a genetic disorder and it's just something people do, and that it may not be a choice. With opioids, they say, oh, well, you're injecting heroin because it's a choice, and it's not. People get exposed to opioids that are things like prescription pills, like Vicodin or oxycodone, OxyContin, codeine even, and that has the same effect on the brain as heroin does. And so a lot of people who use pills actually transition to heroin when they lose their supply, because it literally changes the brain in a way where your brain's main concern every day, waking up 3 times a day, is to find pills and use pills to prevent from getting sick. It's no longer taking drugs to get high and have a party. Most people, you're taking drugs just to not get sick. And most people work, most people have lives, most people have kids. This is something that affects not just the poor or other different classes of people, or it only affects people in one town. It really affects people, when you look at the stats in Massachusetts, it affects people in every single town. And so it's not that I don't know somebody, you probably do know somebody, whether they're actively using, in treatment, or in treatment in recovery. But it's not a moral choice. I think that's the biggest myth. There's at least a 50% reduction in opioid overdose death. And so that's a number that you can think of, like 1 out of 2 people who use methadone, according to many, many studies, are not going to die of their opioid use disorder, what I call addiction, right? I call it a disorder because it is a disease. It is relapsing remitting. And methadone, you know, you think of somebody who is those people, and again, it's all people. And methadone or buprenorphine or Suboxone is a brand of buprenorphine that you can buy at pharmacies, and another drug that can be taken as pills or injected once a month called naltrexone. Those are all medications that are used to treat addiction. And so we don't say, oh, they're opening up a heart failure center or a diabetes center or you know, a lower back pain center. We have a problem with methadone centers, but we have to treat it like a chronic disease and to realize that crime goes down, quality of life goes up, and we have 40 years of experience using a very effective drug that's not just a substitute for the drug they're using. It really is a life-saving treatment for their disease.
That's it for today's update. For DoubleACS News, I'm David Angel.